Kratom is the next absurd target of the DEA. As if they haven't already done enough damage with the failed war on drugs, the DEA has now banned this plant. Native to countries including Thailand and Malaysia, Kratom has been rising in popularity in North America due to its many benefits, including the ability to lower blood pressure, relieve pain, boost metabolism, increase sexual energy, improve the immune system, prevent diabetes, ease anxiety, help with addiction, eliminate stress, and induce healthy sleep. But the DEA is a government agency, so I'm sure they acted fairly, doing their research and properly justifying this ban. I mean, just look. As an example of the risks of Kratom, the DEA cites a CDC study published this summer that counted 660 poison control calls during a 5-year period, from 2010 to 2015, on behalf of people suffering untoward reactions to the herb or teas made from the plant material. Wow, 660 calls over 5 years? That's a whopping 0.004% of the 3 million or so calls received by poison control centers each year.
Stupid.
In fact, to further put how small a number 660 over 5 years is, poison control centers received 6,843 reports of young children ingesting single-load laundry pods in just the first 7 months of 2016. While cosmetics and personal care products, cleaning solutions, antidepressants, and antihistamines each accounted for more than 100,000 in 2014 alone. There have only been 30 deaths associated with Kratom ever, over the entire world. And in many of those deaths, Kratom was combined with other, more harmful drugs, meaning it's not clear if Kratom was the cause. Meanwhile, alcohol leads to 88,000 deaths a year in the US alone. And because the DEA is classifying Kratom as a Schedule I drug, scientific research on it will be that much tougher. To do research on Schedule I drugs, scientists have to gain DEA approval and often upgrade the security protocols in their labs, expensive and time-consuming hurdles. Schedule I is also what cannabis is currently classified under, meaning that, according to the DEA, it has a high potential for abuse. Nope. It has no currently accepted medical use and treatment in the United States. Nope. And there is a lack of accepted safety for use of it under medical supervision. No. This is why people don't trust their government. Many laws are not based on facts or scientific data. They're knee-jerk reactions that have no basis in reality and, more often than not, are informed by special interests with lots of money who influence laws to their benefit. I find it very interesting that the drugs that get banned are ones growing in nature, meaning pharmaceutical companies cannot patent and make a large profit off them. And the legalization of cannabis is already having an effect on the pharmaceutical industry. A study by the University of Georgia found the savings due to lower prescription drug use were estimated to be $165.2 million in 2013, a year when 17 states and DC had implemented medical marijuana laws. And a study from the Center for Addictions Research of BC found 80% of respondents reported substituting cannabis for prescription drugs. With plants like cannabis and kratom, nature is giving us free natural medicine, with more benefits and less side effects than pills. But because it endangers the profits of pharmaceutical companies, it gets banned. People are not going to put up with this much longer.